Invitations can change your life. How you respond to an invitation can change the course of your life. Welcome to Heart Talk with me, Dr. Charles Lee.
A heart surgeon by profession and a philanthropist by nature, Dr. Gokhale and his whole team of surgeons, nurses, sisters are here on this road of recovery for those of us who have had heart bypass. It is my pleasure and my honor to welcome Dr. Gokhale. Dr. Gokhale, welcome to Heart Talk.
Thank you, sir. Nice meeting you.
Nice meeting you too. First successful human-to-human transplant in 2004. First successful lung transplantation in September 2012. Successful heart transplantation on a 69-year-old man, oldest man in India. Pioneer in minimal access heart surgeries. Tell me, as a surgeon to another, to be able to take a heart out of one patient and place it and transplant it into another and get that, to see that heart beating, must be the pinnacle of your medical career.
Yes.
Tell me that moment, sir. What's it like for you?
Yeah. Till that moment, it was there in the books. We have seen it happening. But once you do that, you get a feeling that yes, you could do something to your people, and what has not been available for a long time, you could bring it to the local area so that people with the problem can get benefited. So far, we have been leaving these patients to just God. We are not doing anything. Now at least there is another thing that can be done which we could not do before. Now see a patient who is going to die in a few hours or few days time, getting up, walk around and then taking care of his family, do everything like all of us. So difficult sometimes to say who underwent a heart transplant if you get that person among us. So looking at those people, it gives a joy which we cannot explain, we can only feel.
Well, what made you take up heart transplant? I mean, what was there in your career that you said, I want to go ahead and do this heart transplantation? I mean, what led you to that direction?
Yeah, see, I got trained in heart transplant, lung transplant program at St. Vincent, Sydney in 1992. I went there.
St. Vincent?
St. Vincent's, Sydney,
Right.
Australia.
Right.
That time they were doing the largest number of heart and lung transplants in Australia. And seeing those people recover from their deathbed, walking around, oh my God, these people are doing it. Why can't we do it? Why can't it happen to our people here? That's the time, and it took me almost from 1992 to 2004. Imagine 12 years to make it happen here. Once I came back, I was looking at stabilizing my practice, establishing myself, looking at the opportunity to take it to the next level. I mean, you see, we have to know that if we do the same thing as everyone is doing, we have not added value to our life, to this world.
Right.
I mean, just coming and going is not everything.
Sure.
I mean, by making things happen, taking it one step forward, it gives an immense satisfaction that we have done our part in this life.
In this life.
I mean, I always wanted to do heart transplant. When it happens in Australia and America, why not in India? Why not in my place?
Right.
And when it happened, I know I could do something.
Fantastic. You know, I noticed that the philosophy in your practice, and that too in the hospital, is know your heart.
Know your heart. Correct.
And as a doctor myself, it's the last thing I ever put in my calendar. I mean, you know, I'm a plastic surgeon. I mean, we go out there, we see our patients, and knowing your heart, in the medical profession at least, it's something that, you know, and if it happens to a doctor, what more the layman on the street? And the reason why I ask this is because now there is this move towards educating the public.
Correct.
I know you are a chairman of a charitable trust that looks after the health and the welfare of these patients, and I thank God for that. But tell me, how important is it to know your heart? To the ordinary layman. I mean,
Absolutely, absolutely. See, in this life, we take everything for granted. We only look for what we don't have. We often forget what we have. And the most important in this life, of course, is our health. You have health, you can do everything in the world. You can do everything. If someone can do something, I can do. If I can do something, anyone can do. It is possible only if we are healthy. Everything else can be created around that. But we take it for granted, and we only request God to give us some this, that, always craving after things, forgetting to take care of what we have. and I keep seeing so many people coming here, and then the young people at the peak of their life, and suddenly they get a stroke, the whole family is devastated. Then suddenly you want to work on that, it's already too late. Of course, better late than never, but the only way we can make people stay, do things what they want in life, enjoy this world is only if we can help them to stay healthy. But same thing, a stitch in time saves 9. I mean, people have told us, but we always think all this. People keep talking, and I'm fine, I'm healthy, everything is fine, and you don't put enough time to stay healthy. To pass an exam, we study for years. To get a job, we run around, do so many things. To send our child to a good school, we go around and do so much groundwork. But to stay healthy, what groundwork are we doing? We think it is just the responsibility of God or our people. So I think it is time that we know something about our health, then work on that. When I say know your heart, people take heart more serious than any other organ. And I'm also a heart specialist. I cannot tell keep your kidney healthy or brain healthy. What we say when we say keep your heart healthy, that helps all organs in the body to stay healthy. What we talk about, all things which one need to do to stay healthy for the heart, helps all the organs. It's overall health. Even though as a heart specialist, how to say that keep your heart healthy. But what we talk when we say keep your heart healthy, it helps kidneys, it helps the brain, it helps the lungs, all the organs. If we follow these things, it keeps them healthy so that we can live longer, take care of our people, enjoy this beautiful world. Life comes only once. We don't know what happens next.
I mean, I fully agree with that. Life comes only once. And but tell me, having what, I mean, in your records, it's more than 6,000 open heart surgeries, and now I think it's nearly 10,000. What is the pattern of coronary heart disease? Is it the same in India? Is it the same in Malaysia? Is it the same pattern everywhere else? I mean, I've been in Hyderabad now for what, 3 days? And I've been eating your Hyderabad biryani. And they tell me, watch it. And I say, no, Dr. Gokhale is in town. But as I was walking along the street, everything is in oil, they're frying everything in oil along the streets. And I was telling my colleagues, I said, no wonder he's busy, And so is there a pattern of disease that is characteristic of, which is different in other cases? Or is it the same?
No, the pattern is getting different in this country. See, I worked in Australia, I worked in America, we have seen so many people there. But generally, the disease in those countries happens after the age of 65, 60 years. Then slowly they get the problem, they come here. And then they have a nice, huge blood vessels, heart function is often good. When you do bypass surgery, they do well. But here in India, younger and younger people are getting affected. I have done a 22-year-old person underwent bypass surgery with me. I'm sure that would not happen anywhere in the America or Australia, just like that. We have done a few cases. At least 30-40% of my patients are below the age of 50 years.
Really?
Yeah. See, there are certain issues. In India, the arteries are small, and we have some problem like good cholesterol levels are low, and the type of food we are eating these days. Previously, we were suffering from malnutrition, undernutrition. Now the food, the improving economy, people are eating too much.
I can relate to that.
Yeah. See, the way you said, no, biryani, once you stop, you can't stop it.
Yes.
It's so delicious.
Yes.
But then, see, all the good things in the world are dangerous to us.
In fact, when the chef came,
they become too much.
I told the chef, I said, you got some drugs inside here. And he had a good laugh. He said, no, it's the best in the world. I said, yeah, but it's also the best in the world is your heart.
The best in the world means it's obviously the worst for the health. Anything attractive is dangerous.
Absolutely.
So similarly, our people have got certain issues compared to others. And the genetic predisposition, the stress our people are going through. See, India is one of the few countries where there is an explosion of growth. When you say explosion of growth, you think, you calculate in the terms of how much people are earning, how many cars are there. But the stress behind puts a lot of pressure. About 30% of people are diabetics, 30% of people have got hypertension. Sometime back, one of the newspapers did a study on overall health of about 3,000 people in Hyderabad. And they found only 30% are healthy. 70% either have diabetes, high blood pressure, obesity, Smoking, already a treatment for heart diseases.
Right.
Well, you see, that is the extent of the problems we are facing. You know, diabetes and hypertension are mother for all the problems.
Right.
If we do the same thing as everyone is doing, we have not added value to our life, to this world. But just coming and going is not everything.
Sure.
Or by making things happen, taking it one step forward, it gives an immense satisfaction that we have done our part in this life. But I always wanted to do heart transplant. When it happens in Australia and America, why not in India? Why not in my place? And when it happened, I know I could do something. In this life, we take everything for granted. We only look for what we don't have. We often forget what we have. And the most important in this life, of course, is our health. You have health, you can do everything in the world. You can do everything. If someone can do something, I can. If I can do something, anyone can do. It is possible only if you have health. To pass an exam, we study for years. To get a job, we run around and do so many things. To send our child to a good school, we go around and do so much groundwork. But to stay healthy, what groundwork are we doing? We think it is just the responsibility of God or our people. So I think it is time that we know something about our health, then work on that. When we say keep your heart healthy, it helps kidneys, it helps the brain, it helps the lungs, all the organs. If we follow these things, it keeps them healthy so that we can live longer, take care of our people, enjoy this beautiful world. Life comes only once. We don't know what happens next.
I mean, I fully agree with that. Life comes only once. Coming to the causes, for example, diabetes, high blood pressure, high cholesterol. Now, what I want to ask you is this, that, if someone has got a high cholesterol and has got diabetes, are these parameters running parallel? Or are they all converging on the heart and causing problems in the coronary arteries? I mean, how does this pattern work? Or, I'm struggling with this now because my cholesterol has been normal for the last 6-7 years. But I was overweight. I was 100 kgs 1.5 years ago. I had high blood pressure for the last 5-6 years. And I'm coming to this next question is that when my brother, members of the family had angioplasties and all that, I was continually asked, get your heart checked. And I met my cardiologist and he said, Charles, you go and do a CT angiogram and if there is a small percentage block, what are you going to do about it? Do you put a stent in or do you just wait? So this is the nightmare, the dilemma. And I don't know what it is to have a chest pain. I don't know what it is to have anything concerning the heart. And so I want to ask you that if someone has high blood pressure, high cholesterol, but on medication, everything is controlled, when do you do a CT angiogram?
Very good. You asked lots of questions. The first thing I would say is, in general, in India, anyone more than 40 years of age, we tell them to go for master health checkups. Whether you have symptoms or not, forget about it. Once in 2 to 3 years, get all the checkups. Do a treadmill, check your cholesterol, check your blood pressure, because about 1/3 of the patients with the diabetes or high blood pressure, they don't know that they have it. When they go to the doctor for something else, this comes out. And often it is already late. So like this, you need to go for checkups earlier. You need to do that. And whenever, what your doctor said, he said, suppose they do CT angiogram, they find a small, what will you do?
Right.
I will tell you, Dr. Charles, start working on your body now. That is what I will do. Your preventive measures will start early. Because if you start late, already you missed several years. These blocks in the blood vessels to the heart, they don't start overnight. They start as early as 3 to 4 years of age.
3 to 4 years of age, meaning age.
Children. They found that
this is important to hear from a heart surgeon. Not until 50 and then you find your block. This is like a cancer. It's been going on for 9 years before you can feel a small pebble in it.
Correct. See, when you build a new house, you put in a new drainage pipe.
Right.
Everything looks good. But you take all precautions so it doesn't clog. But search after 4 years, 5 years, you will find some deposits in spite of your precautions.
Right.
Suppose you don't take precautions, something will get inside, some cloth or something get blocked. If you remove it, it's not becoming totally normal. Still there are small deposits. So that you take precautions so that they don't worsen. Similarly, they found in children who died in accidents, when they did post-mortem, they found there are already blocks in the arteries.
Really?
The heart is pumping at a pressure of 120, 110 against the blood vessels. Over a course of time, the blood vessel will get damaged a little bit. In spite of the best mechanisms of the body has to repair them, deposits will stop. You take a syringe and with a syringe you push saline against a wall with force. After some time, in the best of the walls will start showing damage. Same thing happens in the blood vessels for years. So they start at the age of 3 to 4 years. Depending upon the risk factors you have. Suppose you have a diabetes, high blood pressure, you are obese, you are sedentary, very stressful, high cholesterol level, have a genetic influence, you are eating bad food, deposits will grow fast.
You're talking about me, you see, because this is this is what has been happening.
Yeah.
And coming to all what you're saying, the CT scan report,
Yeah.
CT angiogram report
Angiogram.
says, okay, 70% block. Now this is a two-dimensional report.
Correct.
How does that determine? Because I was told when my cardiologist saw it, he said, don't worry Charles, CT scans overread. You must have an angiogram.
Yeah.
And the angiogram tells you there's a 70% block. How do you decide, okay, I'm going to stent this patient or I'm going to go for heart surgery? I'm a surgeon,
Yeah.
I opted for heart surgery.
Yeah. Yeah.
How do you decide that?
It's an excellent question. This is a major confusion among patients. See, it is not like maths. 1 plus 1 is equal to 2. In this, lot of medicine requires a lot of experience behind. You know that proverb, never go to a new surgeon and an old barber.
Yeah, right.
Because the theory is different from the practice. But in general, there are some guidelines to help us out. For example, the block is, there are 3 blood vessels to the heart. Well, this is how the heart looks. Actually, it is on the left side of the chest, left of the breastbone, size of a closer fist. And this has got 3 blood vessels on the heart to supply blood. One on the front, this is called left antedescending artery. And on the left side, this is called left circumflex artery. And on the right side here, there is the red thing that is called the right coronary artery. These arteries start from this big blood vessel that takes blood from the heart to the body. This is called aorta. And from here, the right comes directly from here. And the rest of the 2 start as one blood vessel called left main coronary artery, which goes behind this vessel and divides into 2 branches. And these divide further, supplying many branches throughout the heart. So these 3 carry all the oxygenated blood to the heart. And whenever there is a block in one of these blood vessels, that is when people develop what is called angina or heart attacks. That means there is a block in this blood vessel. The blood is coming up to here but not able to go beyond that. And this muscle is crying for the blood. If it is something that is happening over a course of time, then they get some chest pain while they walk because heart rate goes up and this muscle wants more blood supply. At rest, this blood supply is enough through the block. But when they walk, they require more blood supply. And sometimes this block suddenly, this whole muscle dies. This is called heart attack.
Where's the obtuse?
Yeah. When you say there, see, for technical things, we give the names. For example, this is called left antedescending artery that supplies 50% of blood supply to the heart. And it gives branches. These are called diagonal arteries. And there are some branches that go into the heart called septal branches of the LAD. And now similarly, the one on the left side called circumflex artery, it gives branches called obtuse marginal branches. For example, you see here, the blood vessel, the angle here is obtuse. That's why they call obtuse marginal branches. At the end, it divides into what is called posterolateral branches because it is the posterior side of the heart and the lateral side is called posterolateral branches of left circumflex. Similarly, for example, this right coronary artery is there. When this is coming, there is a branch that comes from here. It is called acute marginal branch. When it comes down, it divides into multiple branches. 2 important are posterior descending artery. It goes here on the inferior side of the heart, posterior descending artery, and there is one more branch called posterolateral branch of the right coronary artery. Usually it is the blocks in the major blood vessels, LAD, circumflex and the right coronary artery that are more dangerous. As the branches become smaller and smaller, they become like 0.5, 1 millimeter. The blocks in there can produce small heart attacks, but rarely they produce risk to the life.
So when you do a triple bypass, where would you put your...
Generally.
Generally,
see, suppose the LAD, we put one to the LAD, one artery from here into the mammary artery, and then to the right coronary artery, sometimes a vein from here to the right coronary, or to the posterior descending artery. That is its most important branch. And one from here to the obtuse marginal branch, we put it. So generally, when we say 3 blood vessels, they have blocks called triple vessel disease. When we put 3 grafts for all these, it is called a triple bypass. Sometimes this diagonal branch, or there may be 2-3 branches on this side, 2 branches on this side, which are big. Any blood vessel that is 1.5 millimeter or more, if it is blocked, we can do bypass surgery. Some people have 5 bypasses, 6 bypasses, but there are only 3 major vessels. That is because we bypass to the blocks in the branches of these blood vessels also, diagonal, and 2 or 3, OM2, OM3, posterolateral, like that. So depending on the size of the vessel that is blocked. So heart is here on the left side of the chest, pumping blood to the whole body. And this is a muscle. It also requires glucose, oxygen, all the nutrients. So what it does is, when it is pumping good blood, oxygen blood through this major vessel, it supplies first blood vessels so that it stays healthy to support the body. This front and the left side one come as one from this called left main and divides into 2 blood vessels. And the right comes from here. Suppose there is a block in the right somewhere here, or in the left-handed descending vessel here, and the circumflex somewhere here, and the heart function is good, and it is a small block, like you see, length is only say about 3 or 4 millimeters, 5 millimeter, but the block is 80-90%, you can put a stent. Put a balloon inside, like angiogram, you put a balloon inside, inflate it so the blocks get expanded, and then put a spring inside called stent. That helps. But for example, you have a block in the left main, stenting is dangerous. Similarly, this front vessel is called widower's vessel. This vessel supplies 50% of the blood supply to the heart. These two supply 25%. At the beginning, suppose this gets narrowed, if you put a stent, the failure chance is high and it gets blocked, people can die. This and this can excuse us, but not this and the left main. So if there is a block in the left main, or a block in the beginning part of this, for example, there are multiple blocks in the blood vessels, any of these vessels, because you can put in 1 stent, 2 stents, sometimes 3 stents. But each stent has got a chance of restenosis inherently. You put 1 stent, 5% block. You put 2 stents, it becomes actually 15%. Each one we think 5, but together the cumulative effect becomes more. So you put 5 stents, in 6 months you are going to come back for surgery and you spend lots of money now. There is no point. So there are multiple blocks. And there is a major vessel which if it gets blocked, person can die. Already patient has got a heart attack, heart is weak. In those people, you do angioplasty, the long-term survival is less compared to the results of the surgery. So now the Cardiological Society, European Cardiological Society, American Cardiological Society, they are given clear-cut indications that only when the blood vessel, single vessel is blocked, somewhere in the mid, then you can try angioplasty. But if there are multiple blocks, heart function is weak, in the left main there is a block, then they better go for surgery. Unless there is a high risk with surgery. Sometimes people are say about 90 years. Kidney is not working well, or the lungs are not working well, there are blocks to the blood vessels to the brain. In that situation, as a bailout procedure, you may do 1 or 2 stents. That is how once we do angiogram, we know how many blocks are there, where are they, how serious are they, and what is the condition of the patient's body. Based on these things, we make a decision whether we should go for bypass or angioplasty.
Thank you. Let me just take this further. Now let's say one vessel has got a block, 75% block, and you put a stent, and the other 2 are pristine. Pristine meaning nice and clear.
Nice and clear.
Now, I know a relative who has that, and they say, I'm fine. What is the chance of the other 2 getting blocked? I mean, over a period, it looks beautiful. I've seen the angiograms.
But you have to remember, we are looking at the shadows. The tests which we have today are not perfect. Science is not yet perfect. We are going to get in future some more investigations that can make things better. So unless there is a significant block, you may not, and as you said, sometimes there are like 2-dimensional views. They are not real views. So many times as surgeon, they do ultrasound, they do X-ray, they tell it is like this. When you go inside, it's totally different. Maybe the cancer is totally spread inside, which none of the tests have shown. So they underestimate the disease. If someone has got a block in one of the vessels, they are likely to get blocks in other vessels compared to anyone else.
Right. Okay, and that's a good point.
That is very important.
Yeah, because that's already a disease process.
So it doesn't happen in only one area. I keep telling my patients, body is full of blood vessels.
Right.
If someone has got a block in the heart, they may have blocks in the brain too, in the kidneys too. But where it is severe, they develop a problem. The severity is more here, they develop a heart attack. If severity is more here, they develop a paralytic stroke. If severity is more in the kidney will fail. If severity is more in the eyes, they lose the vision. If someone has a block in one blood vessels, they definitely have disease in other blood vessels too.
Okay.
So don't think that if someone has got a single vessel, it's very good compared to someone who has got 3 blood vessels. Definitely it's an advanced disease, but remember, you are not far away from them.
Okay. Well, this is very important, because I find that a number of people ask these questions, you see, and they battle with this. I'm going to go for stents because it's less invasive than having an open heart surgery.
Yeah, sure.
But coming to talking about bypass surgery, I mean, I had my bypass 1.5 years ago. It was a shock to me, total denial. Always thought that I'm okay, everything is fine, you're a doctor, that kind of thing. But it was the most traumatic experience, lying on the table and getting shaved from my neck to my ankle. I felt like, this was the first time I'm being born. And totally numb, And I want to ask you that, does it matter whether you got triple vessel disease or single, in the sense of the number of vein grafts? I'm coming to vein grafts now. I had my 7 vein grafts taken from my thigh, 4 incisions. And I do vein surgery, varicose vein surgery. And I know that if I put my catheter in, slight rubbing on the vein, I've got a thrombus going on. So tell me, the number of vein grafts that are put in. I know the guy who was sitting in the next room, he had 4 bypass.
Okay.
I had 3. Somebody else I know had 5. Does it really matter how many vein grafts you put in?
Yeah, yes, it matters. It matters. See, it is like the extent of disease we have. That means someone who has got 3 blocks, 4 blocks, 5 blocks, the disease is already a little more advanced than someone who has got 1 or 2 blocks. So they have to take more precautions, and they have to be more stringent about their lifestyle, number 1. And number 2 is, the beauty in nature is, we think we are doing a great job as doctors and as engineers. But remember, at no time we are anyway close to the nature's designs. For a block in an artery, you take the vein from the leg and put them there to bypass. See, the artery is working under pressure of 120 by 80. Its structure is meant for that. Whereas the veins, the pressure is only say 3, 5, 10 millimeters of mercury. Yet that pressure, you bring that one and put under a stress of 120 by 80 millimeters of mercury. Some people are hypertensive, so 180, 160. Imagine a child doing an adult's work.
Okay.
What happens to them?
You're worrying me.
No, what I mean to say is, but see, that's why, not to worry you, what I want to tell you is, whatever has happened. We cannot do anything. But if you take precautions these days, these vein grafts also can work for 15 years, 20 years. My father underwent bypass surgery with vein grafts in 91. That time, internal memory was not popular here. And today it is 2005, the past 20 years, he's doing fine. But he takes medicines regularly, he does walking, he watches his food, precaution, what is there in the book he follows. And he is now close to 90 years.
Wonderful.
Yeah. So what I mean to tell you is, it gives you warning signals. It tells you, Dr. Charles, so far it's okay, you took things for granted, but now watch out. You take precautions, I will take care of you. You still go in the same path as before, you take things for granted. I had blocks, fortunately doctor saw that, he did bypass, I said, now I'm close to normal. You think? Then we are going to face trouble again. Some of these people who undergo bypass surgery, that's why they come back for 2nd time, 3rd time operations. So your part you have to take care. But if you ask me, Dr. Gokhale, I'm taking all the precautions. I lost 18 kilos weight, you said, from 100 to 82 kilos. you are taking medicines, you are watching your food, but can you assure me that I won't get to have problem? I will be all right for the next 30, 40, what God has given me. There is no way anyone can assure, because multiple factors work. We do not know what exactly is the reason for these blocks to increase fast. Only in 60% of the cases we know diabetes is responsible, obesity is responsible, the food you eat is responsible. In 40% of my patients, they are thin, non-diabetic, no high blood pressure, and they do meditation, they do walking regularly, and they don't eat non-vegetarian. Very clear? We do not know. See, there are many mechanisms. They all play, multiple things play a role, and the end result is this. So when we tell a patient, it's not that we tell you just walk, do this. Depending upon the factors you have, we have to advise you that you have to work harder, you have to cut down stress a little more, you have to modify your lifestyle for sure. Not just modify, you have to change your lifestyle. So depending upon the factors which are playing in our body. But the most important thing is, once you work on these things, you can stay healthy, have an excellent quality of life, and you enjoy this beautiful world. Do what you have come for. But here in India, younger and younger people are getting affected. I have done a 22-year-old person underwent bypass surgery with me. I'm sure that would not happen anywhere in the America or Australia, just like that. We have done a few cases. At least 30-40% of my patients are below the age of 50 years.
Really?
Yeah. See, there are certain issues. In India, the arteries are small, and we have some problem like good cholesterol levels are low, and the type of food we are eating these days. Previously, we were suffering from malnutrition, undernutrition. Now the food, the improving economy, people are eating too much.
I can relate to that.
Yeah. See, the way you said, no, biryani, once you stop, you can't stop it.
Yes.
It is so delicious.
Yes.
But then, see, all the good things in the world are dangerous to us. How did you end up with the doctor? First of all, you never had chest pain?
No, because what happened was I had high blood pressure. And I was putting on weight. So they changed my blood pressure drugs. And I was operating, and I didn't like the side effects of this Novas. And I was going to go to England with my two sons. And I said, listen, thank God I'm a doctor. I think it was a layman. Today there won't be no interview.
Yeah, sure.
And I said, I want to see my heart.
Yeah.
And the cardiologist said, look Charles, we have tried everything, we better have a angiogram. And that's how, when I looked at the report, I was numb. Shocking. What on earth is this? And I guess it's, it was God's intervention in my life.
I think.
But tell me, sir, if that report came to you, what would you tell me as a patient?
I would tell you, look at this, Dr. Charles. You have got many blocks in the heart. How old are you now?
60. I've just 60.
60. As I said, even doctors do not know that they have to go for regular checkups after 40 years.
Right.
You see this? You see, we keep telling so many to the patient. Even we ourselves do not know about it. So you already missed the boat a little bit, but it's good that you found it now. You got multiple blocks in the blood vessels, but that means you got a quite extensive disease. That is a negative side. But the positive side here is, see, your heart is working very well. See, one of the most important things for people to live longer is how is the heart function. If you had a major heart attack, heart function from 60% has come down to say 25-30%, they will not live as long as the people with a good heart function. You have a good heart function.
65%.
So you will 65%. Fortunately, heart is not damaged, and you have multiple blocks which are found in time. So you need to go through bypass surgery for these things, so that you can stay healthy for the next few decades, provided you take care of yourself. And do not look at other options. Many people think that people like this multiple blocks, we can try medical management, we want to avoid surgery, we want to go for angioplasty, we want to try alternative medicines.
Right.
There are many alternative treatments that are available in other specialties. But remember, the treatment of coronary artery disease has been very scientific. Thousands of papers have been published on coronary artery disease. It is one of the very few topics that have underwent extensive studies in the whole of medicine. So with all this scientific background, don't go for alternative medicine, which may work, but which do not have enough scientific backup. If you want to try on myself, I want to take the proven treatment. not some experimental. I go for experimental when proven treatments are not possible for me. So for you, surgery is the best option, and we will try to take a mammary artery from here. It's called intra-thoracic artery. Put it to the vessel on the front, and when you have, suppose people have 2 blocks or 3 blocks, and non-diabetics, we can try both intramammary artery. But someone who is a diabetic, who is obese, who has got so many blocks, it's very difficult to revascularize with all arteries. So we generally use one artery, and the remaining we take a vein from the leg and put it there. And the artery will work for a long time. The 10-year working of this artery, which I said internal mammary, is about 98 to 99%. That means in 100 people at the end of 10 years, this artery is still open, doing very well. Whereas the veins, they have about 10-20% failure by the end of 10 years. Provided you take good precautions, they can stay open for long. For about 10 years back, for example, these veins were closing very fast. Those days people were not taking precautions. They were not controlling diet, they were not doing exercise, they were not watching their blood pressure, diabetes. But a lot of education went on into this. Now people are very careful about their health. So that's why these vein grafts, at the end of 15 years, 20 years, they are working very well.
Right.
So that's why for you, you have to go through the surgery. It's traumatic, no doubt about it. But afterwards, you take all the precautions which you have been talking about, and then go for, don't forget that you have to go for checkups once in a year after this. In between, you may go for medical management. Make sure your blood pressure is under control. These days, for blood pressure and diabetes, it's very easy to control at home because you've got those small equipment, automated things, which you can check and adjust. And once you do that, every year, you need to check your lipid profile. You have to check your treadmill, ECG, treadmill test, and do a echocardiogram to see how the heart functioning. Many a time, people with the diabetes, they think our sugar is under control with the medicines, so we stop the medicine. That is what they tell me. Your sugar is under control because you have taken medicines. Your grafts are working because you have taken medicines. But you never know, still it is inbuilt in the nature that the blocks will slowly progress. Today we have some treatments to bypass the blocks, to open them up. But in the recent past, some drugs like statins have come, which have shown to cause a regression of the lesions to some extent. In future, some more drugs will come, which will cause a regression. But until then, you have to take all these precautions.
When you do a CT angiogram, for example, because I'm told that you'll have a lot of dye and they'll have to find out where the openings are for the grafts, and you're exposing yourself. When should I do it? 2 years? 5 years? Because my surgeon tells me, wait till you have a clinical sign.
Exactly, I tell you. See, remember, blocks do not mean that you develop a heart attack. Blocks doesn't mean that you take about 70 years person, 100 people do angiogram, 90% of them have blocks, 20%, 30%, 60%. It's an aging process. It's an aging process. The deposits will happen from the age of 2 years, 3 years, they will progress. But the progress should be slow. So when you do a CT angiogram, it shows you blocks in all the small blood vessels, 1 millimeter, 0.5 millimeter, those things may show. It doesn't mean anything. We cannot do, they are the medical problem. We already know that you have a problem. The major blood vessels, as you said, the 3 blood vessels on the front, they are about 2, 2.5, 3, and they feed all the small vessels. If there are blocks there, we can do something. For the small vessels, the drugs we are taking is enough. So when you do a CT scan, you find some blocks, you start getting worried. But we can't do anything. Why getting into trouble when you cannot do anything? So that's why I said every year you should go through a treadmill. Now for example, first time you do a treadmill, it's normal. And after 3 years the treadmill is positive, that means the disease has progressed. That is when I will put you through a CT angiogram. Whether symptoms or the treadmill or the echo shows that disease is advanced, then I put you. Otherwise, don't bother getting it done. And you asked one question some time back, someone who are normal. See, going for an angiogram, always people get worried, I have to get to the hospital and then all this, inpatient. Hospital is always a hospital, people don't like to go there. Whereas CT angiogram is a simple test, you go like a scan, they do less than a minute to do the test. You just go there from office, get it done and go back home to the office to do your work after 1 hour. But so people think that if you do CT angiogram, I can find out disease very early. But again, don't go that far. People who have got multiple risk factors, obesity, hypertension, diabetes, family history, high cholesterol. Some There are some risk factors: diabetes, high blood pressure, high cholesterol, smoking, hypertension. These are all major risk factors. Obesity, if you have at least 2 of these things, then you should go for these things yearly, even though you don't have symptoms.
Get it properly checked out.
Get it checked out. But if you have one risk factor, you do not have symptoms, just try to control it. You don't have to go through that. You just go through a treadmill, those things are enough.
Okay.
So CT angiogram has got a lot of irradiation. Once you go through a CT angiogram, better not go through another CT for next 3-4 years. It gives you so much irradiation.
Right.
So better wait, either in develop symptoms or one of these basic tests, simple non-invasive tests we call them, a treadmill test, echo, ECG. Those things show that previously they were okay, now there is some deviation. Then you go for these things.
Very good, sir. Okay, excellent. Now, coming to heart bypass surgery, I've had my bypass, and the night before surgery was the most difficult for me because I wrote 4 letters to my family and addressed them to my wife, Monica, to my 3 children, Jeremy, David, Sarah, wrote a letter. And the morning of the surgery, I gave them each this letter because I'm not a heart surgeon. But they think I'm going for an appendicectomy. See, they don't know the seriousness of this. Now tell me, sir, having done thousands and thousands of open heart surgery, what is the risk for those who are listening in of heart bypass surgery? What is the risk factor in the surgery itself?
Oh yeah. See, there's nothing in life is 100% safe. Every day we walk on the road, we are taking a risk. Sometimes we cross busy roads. In fact, we have taken much more risk than most of the surgical procedures. So if someone tells you that, okay, you are going to go through surgery, you are going to be 100% safe. I have done 10,000s. But if I tell someone that you are going to be 100% safe, I know of surgeons, but first thing is don't trust them. They are not telling you the truth. Every procedure is associated with some risk. But then we have to balance. With the medical management, the risk is 50%. With surgery, the risk is 2%. Which will you choose? I will choose the surgery. But having said that, the moment you say surgery, it's very stressful to the family and to the patient. But then, this is the best we can do to save the people. If everything is fine, people do not have, they are not less than say 70, 75 years of age, and they are not very obese, and then the other organs are working all right, kidney, brain, lungs, everything is working all right, and the heart function is good, then the risk is less than 2%. That means 98% of people have to go through the physical, psychological trauma, but they will come out, do well, take care of their family, take care of their life, enjoy this world. But which one out of those 100 we cannot tell. But there may be a reaction to the drug, and the bypass grafts may block, they may have bleeding tendency, and anything can happen. They may have a paralytic stroke. 2 out of 100 can have complications. That we have to make sure that the patient and attendants understand. Especially attendants understanding is very important. Because patients, if they are fine, they don't question. If they are not fine, they don't question. But the attendants have to understand. And I always tell the people that when someone advises you to go through a bypass surgery and angioplasty, just don't do that. You know the surgeon, you know the doctor very well. But take a second opinion. Always take a second opinion, because there are some borderline cases where medical treatment may give equally good results, but an experienced person may be able to tell you that. Whereas someone who is young, with a lot of knowledge, a lot of enthusiasm, may overdo things. That's why I always tell my patients, I think you should go through surgery, that's my feeling, but you always have a right to take a second opinion. Take an angiogram CD, go to another doctor, maybe one of his patients suggests, or you heard about him, someone who has been there for a long time in the place and practicing, take one more opinion. And only you get convinced before you jump.
Wonderful.
But that is very, very important.
I have a scar. And you know, we used to have this cowboy program those days when I was young called Have Gun Will Travel. So now I've got this, I have scar will travel, you know, everywhere I go. I still get pain. 1.5 years, 2 years ago. And I go into the internet and they're all saying, oh, it's just 2 months, doctors say 6 weeks, you can do what you want to do. And when I cough and sneeze, I get this pain. And my children think I'm putting on you. Daddy, it's already 1.5 years. And I say, no. Now tell me this surgical scar. I mean, is this pain for the rest of my life, or is it a...
That's a very, very important question you asked, Charles. Because this is the reason why we keep talking about minimal access surgery these days. See, the first open heart surgery really started in 1953. It's a relatively recent. It's not like a plastic surgery. It is there before crash. It is probably one of the first things. Skin grafting was probably the first surgical maneuver that was done in the history.
Right.
That was the actual first transplant that was done too.
Yeah.
But the surgeries, millions of people have survived. But remember, we cut a bone and we stitch the skin. And once you do that, especially the skin here, you know very well it is more prone for keloid.
Yes,
Here
I have it, yes.
Yeah, here as well as there.
Yeah.
And people come to me after years, Dr. Gokhale, see, you saved my life, but I'm suffering this problem. I can only say, I'm sorry, this is the best I can do at this stage. Because all the heart operations are going through this till now. So about 10% of the people develop hypertrophy of the scar, keloid, and then complaining about a year, 2 or 3. As you said, like your children, all the attendants think that, oh no, you are able to go to your movie, you are driving, you are doing everything. Right. But then when it comes to suddenly you say, how this comes? Yes, some people have learned because this healing, this mechanism is totally unknown. Some people do. Unfortunately, I cannot help. I can only assure them that your heart is fine, but they are having a real problem. That's why these days we are able to take this one more step forward, do what is minimal access surgery. Because any scar on the side of the chest heals much better.
Yes, yes.
And it doesn't produce keloid. And these days for some people who are able to do this bypass surgery through a small incision below the nipple, through the intercostal space without cutting the ribs, without cutting the breastbone, and these people, they are so happy. You should see some of them, they come back. They say that when I'm going for walking, people ask me, I underwent the surgery, they show me the scar, I have a lot of problems. When I show the scar here, they say that, no, I don't think Dr. Gokhale did bypass surgery for you. Just go get verified. Because it gives them so much satisfaction that they don't have this problem. See, science is
advancing,
advancing. As you go along, I'm sure in future, some people can get done through airports. I keep telling the same thing to all my colleagues. Another 20, 30 years, 40 years from now, suppose 30 years, and if God permits, I'm alive, my grandchildren come and say, when one of my patients comes and says, your grandpa did my surgery, look at this, he did my bypass surgery, I'm alive, then they would come and say, Grandpa, are you a butcher or a doctor? You made such a big scar on his body, you cut to do his surgery? Because by the time all this will be controlled by medicines, and I'm sure some of the minimal access things will come, like through a thoracoscope, robotic, you do the surgery, send the person home in 2-3 days time, they go back to the work in about 1 week, 10 days time, with a lot of confidence, taking all the precautions. That is what we are going through. So we should never give up. We have a diabetes, well, we have to live with it. But if we manage diabetes, we can live like other people, enjoy the life. We have bypass surgery, not to worry. Already what happened has happened. But you can take the precautions so that your heart continues to be healthy. But you have to work harder than other people because we missed the boat in the initial phase. But they take the precautions, do everything. People say that don't eat that, don't eat that. It is true. There is only a guideline. So many patients ask me, Dr. Gokhale, I like mutton. I like mutton biryani. They say, no, don't eat it. Stop it. Eat vegetarian. Then what's the point in living for 30 years if I don't eat what I like? It is true.
Let me shake your hand there.
No, it is true. You eat, but cut down.
Yeah.
But cut down. Previously, I was eating mutton every day. Make it twice a week. Enjoy your limitations. Because we are not meant to live in this world. Not doing what we like. Your profession is stressful, but you still enjoy it. So maybe you do modifications so that you still enjoy the work part-time and probably take less stressful thing at the rest of the time. But do what you enjoy. You are meant here to enjoy this world.
Amen, amen. I want to just now slowly end by something that I've noted, which happened to me, which is a surprising sign of an unhealthy heart. Some say that you can have neck pain or systems pain or whatever. Erectile dysfunction.
Yeah.
I had that about 2 years before I was diagnosed as having advanced heart disease. So tell me, how does that affect, does it also affect the blood, like you said, it affects blood vessels everywhere? Because it really affected me and I didn't know what was the cause. But now I know that I warn people, in fact my own urologist, I say, listen, anybody coming in with erectile dysfunction more than 50 years, get the guy checked out.
It is true, it is true. See, there may be telltale signs like this erectile dysfunction, someone having a little toothache without a tooth problem. See, people have talked about these things. But for a cough, there are 1000 reasons for cough. Erectile dysfunctions, there are about 110 reasons for erectile dysfunction. So anyone, that's why I said anyone past 40 years of age, even if everything is fine, get your checkups done. Don't imagine yourself that you are fine. That's important.
And finally, sir, the first book I bought after my heart surgery, I was in Kuala Lumpur and I went to the bookstore, was this book by Dr. Ornish, where he talks about reversing heart disease. And I, as a surgeon, I mean, they come to see me for beauty and cosmetic surgery, and they tell me, can you reverse this aging? I say, nonsense. I can delay it. There are certain procedures that we can do to try and, prolong it, but no way I can reverse it. Now tell me honestly, as a heart surgeon, is there anything as reversing heart disease?
The blocks in the blood vessels, you see, you have to understand the meaning behind it. When we are saying a reversing here, a block that is 70% is becoming 50%.
Okay.
Not that totally disappearing, or that it becomes like a beautiful blood vessel of a 3-year-old child. It's not like that. What we are seeing are shadows. No one can go actually inside and see. We are underestimating a lot of disease. Suppose, even sometimes we see angiograms, people come with the angiogram for surgery, but I have a little doubt. When I repeat an angiogram, we find it's only 30%, not 70%, because it depends upon which view you have taken and how much focusing has been done. There are a lot of man-made errors can happen estimating these things. These are all visual, not really technical most of the time. But having said that, I strongly believe that this is possible in blocks in the arteries, because what is that is producing blocks here? Most of the time it is the fat deposits that are happening at that place. And what happens whenever there is a fat trauma to the blood vessel, fat deposits, the next thing is scarring, fibrosis. If fat deposit, if there is a lot of soft fat there, it can look like 80%. If there is some way you can get it replaced with a hard fat, you can make it undergo fibrosis, then what 80% can become 50%. 50% is perfectly fine. You see, the nature, God has given us so much of a reserve. A 50% block, I am not worried. 60% I am not worried. But if it becomes 80-90%, the reserve is coming down. So what we are doing is not totally reversing, we are increasing the reserve.
Okay.
So it is possible, like example I said, statins. This is meditation. The stress, whenever you put the stress, a lot of catecholamines are released. Vessels undergo spasm. What is 50% before, when it undergoes blood vessel narrows, it becomes a 90%.
Right.
So all these things, the stress factors, and then for example, the drugs that have come, all these things can, yes. And second thing is, when you do some exercise, as you said sometime back, people develop collaterals.
Yes. Myself, over the years.
See what happens when there is a soft block there, it can suddenly rupture. It may be 30% block, but it can produce heart attacks. So do you know many of the heart attacks are produced not by 80% block, but by 20-30% blocks. With the soft fat, when the blood pressure is hitting it like that, suddenly it ruptures. Then clot forms. And by we give streptokinase, other drugs, then do angiogram, there is no block there. Why? Because the fat ruptured and produced the thrombosis. So suppose you can have a mechanism wherein the fat becomes fibrosed early, or only hard fats are deposited, things like that, then probably we can do the reversal, which I think is possible.
Right.
We are increasing the reserve. We are not totally making it normal, but what we need to have is, a 80-year-old person already has, say, about 60% block. But how much work is he going to do? He is not going to job. We can keep him alive, do well, enjoy, go to a movie, spend time with the grandchildren, and probably go to a golf for a little while and just walking a little bit around. That blood supply is enough for him. So that's how we look at things. Yes, the heart diseases can be prevented. Yes, it is possible to reverse it. I'm sure, I'm looking forward for the future. There are a few publications saying that these statins have reversed the disease. Sometimes it can be the angiogram may not be right. It may show less. It may not be actually reversed in that particular case. But it is possible. And with that hope, I think we should live, work hard, do what you want to do.
So with that, I want to say thank you, Dr. Allah Gopal Krishna Gokhale, for doing HEARTtalk with us. Thank you, sir.
Thank you very much. It's my pleasure, and I hope many people will get benefited. Leaving all the misconceptions about these problems.
Thank you, sir.
My pleasure, sir. Good luck. Enjoying limitations, because we are not meant to live in this world, not doing what we like. Your profession is stressful, but you still enjoy it. So maybe you do modifications so that you still enjoy the work part-time and probably take less stressful thing and rest of the time. But do what you enjoy. You are meant here to enjoy this work.